Thank you everyone who's listening in today, who had a hand in collaborating with us in developing the strategic framework, and to so many of you who will be helping us achieve our goal of translating this framework into a national plan on aging. Next slide. I'll share just a quick overview of our agenda for today, and we really hope that you will all leave today's webinar with a better understanding of how the strategic framework helps us build momentum for the development of a national plan. So just did welcome and housekeeping. We will then share a little bit about the Interagency Coordinating Committee on Healthy Aging and Age-Friendly Communities. We'll then walk through the framework itself, called Aging in the United States, a strategic framework for a national plan on aging. And then you'll hear from our team about engagement and next steps. Next slide. Really excited. I'll start with some housekeeping. Excited to be here today and want to just make sure people know that today's webinar is being recorded and we'll be posting it online. We actually have an entire web page dedicated to the Interagency Coordinating Committee, and this will really help us be able to get the word out broadly. As I mentioned, we have captioning and we have American Sign Language, so please use those if they're needed. If you have any issues, we have Q&A and chat, and all participant microphones are muted. Next slide. You're going to be hearing from a number of us today. This really was such a collaborative effort across many parts of ACL, as well as with so many other federal agencies. And I'm really glad to be joined by four incredible presenters. Kelly Cronin, who's the Deputy Administrator for Innovation and Partnership at ACL. Emily Rosenoff, the Director of the Division of Long-Term Services and Supports Policy at HHS's Office of the Assistant Secretary for Planning and Evaluation. Vicki Gottlich, who's the Deputy Administrator for Policy and Evaluation at ACL, and Carrie Benson, who is ACL's Deputy Assistant Secretary for Aging. Next slide. So let me get started in getting into the strategic framework, which we are thrilled was just delivered to Congress. And the strategic framework is truly coming at a really critical moment. Our country is rapidly aging. Every day, we have more than 10,000 people turning 65. And over the next few years in this country, we'll have more older adults than children. And that's actually a trend that's happening internationally too. Older adults bring so much experience and value and contributions to this country, and we need to plan to ensure that we have the resources, services, and supports to help people age well. This framework is coming at a time where we also have unprecedented support for aging issues. And I want to explicitly recognize the strong support from the White House and HHS leadership, especially Secretary Becerra, for the work of the Interagency Coordinating Committee. This administration has truly prioritized supporting older adults in so many of its policies. From its efforts in the Inflation Reduction Act to decrease prescription drug costs, to efforts to strengthen the care infrastructure that's made up both of family caregivers and direct care workers, to work to expand access to home and community-based services, and helping ensure the financial security of older adults. We have really tried to seize on this wind behind our back. So turning to the framework itself, the first thing I want to say about the framework is that it is intentionally high level and aspirational, and its aim is to inspire dialogue across generations at the local, state, and federal levels, and across sectors of society about what it will take to turn the framework's visions, values, and goals into a national plan that can be executed. The framework reflects months of discussions and deliberations led by ACL, but truly was a cross-federal government effort, and we are so proud of what we were able to develop. Before we dig into what's in the framework, I'd like to share a little bit more about how we got here. Next slide. So ACL was designated by HHS Secretary Becerra to oversee and administer the operations of the Interagency Coordinating Committee on Healthy Aging and Age-Friendly Communities, or the ICC. The ICC was created by Congress in the 2020 reauthorization of the Older Americans Act. It was charged with improving federal coordination and driving progress across our nation to expand healthy aging and age-friendly communities. And we are incredibly grateful to Congress and the administration for providing funding for us to get the ICC started as part of the fiscal year 2023 appropriations. And from the moment we got funding, we have truly hit the ground running. That funding allowed the ICC to get started and to drill down and really tackle and move forward towards our goal of creating a national plan on aging. And we've really thought about what are important things that the ICC can do. And the Interagency Coordinating Committee is also working to lay the foundation for the next White House Conference on Aging, which is held every 10 years and with the next one expected in 2025. And really, by coming together as one voice, the ICC has been able to articulate how the federal government and the broader society as a whole can help every older adult who wants to live and age in their own home and in their own communities have the resources and supports to do so. And as you'll see in the framework, our work on the ICC to date has been heavily influenced by the incredible work that's happening in many states across the country in their work to develop multi-sector plans on aging, or MPAs. Our goal has always been to amplify and leverage the work that's underway in the states. So I'm now going to turn to briefly share an overview of the ICC's important efforts. Next slide. So I want to just read the vision of the ICC, and I think the vision statement really captures it well. We envision an America that truly values older adults, that embraces aging, and recognizing that all people have the right to live with dignity, make their own choices, and participate fully in society. And we are a nation that prioritizes independence, inclusion, well-being, and health across the lifespan. And for people who can't see, there are lots of hearts and thumbs up and celebration emojis. And I am so glad that our vision really resonates with all of the stakeholders who are part of this call. It is an important place for us to know our North Star and make sure that our framework and that the work that we put together in a national plan on aging really centers and advances this vision. Next slide. We also thought values were incredibly important and really serve as a foundation for the ICC's collective efforts and need to be a part of guiding the development of the future national plan on aging. And I want to just highlight a couple of these cross-cutting values because, as you'll hear, we have a lot of different domains. There's a lot of things that older adults need to be able to age well, but we have to make sure in every single thing that we do, we have these values. So the first is around person-centeredness and really making sure that we are focusing on the voices, the preferences, and the needs of older adults, and that they are driving towards the life that they want. Inclusion, which is about all people, regardless of age, disability, or life experience, should be able to live and fully participate in their communities. And I want to say just a little bit more here, because a priority for ACL is ensuring that we consider the needs of all older adults. All means all. And that includes identifying barriers that older adults with the greatest economic and social needs face. That includes people of color and Native Americans, people who might not speak English, as a first language, LGBTQIA plus older adults, and people with disabilities, as well as people who live in rural areas. And it is incredibly important to us that we make sure that all older adults see themselves in this framework and in the national plan that will come for this. Respect is critical. We need to make sure that people are able to live with dignity and respect and be free from abuse of any kind. And then finally, collaboration and innovation. I hope we are modeling that by what you hear from us and all of the federal partners and how we've been working together, but we need to make sure that we are doing the same in other contexts. We need to streamline access to programs. We need to make sure that we're not duplicating work, that we're really taking lessons learned, and that we're being creative and thinking outside the box in meeting the needs of older adults. Next slide. Again, I am so happy that in those values, because we have to make sure we know what we are aiming for, lots of heart emojis, thumbs up, and celebration. So I am really glad that we are starting this process by really hitting the mark. So in addition to our vision and our values, which are really at the center, we know that it takes a lot. There are a lot of domains that we really need to think about, and we organized this work around the 4 domains that are reflected in the strategic framework. And this will really help us guide our work moving forward. And I will also note that these 4 domains are based on the authorizing language in the Older Americans Act. The first domain is centered on age-friendly communities and how our communities can and should be fully inclusive of our neighbors who are older adults. The second domain is focused on housing and the services needed by older adults so they can remain in their own homes and in their own communities. The third domain addresses how long-term services and supports can help people age in place and continue to be part of their community. And then the final domain is about the ways older adults can maximize their health and reduce preventable disease and injury, including falls prevention, which is a major focus of our work, as well as a major focus of the authorizing legislation. And each of these domains truly involves all of us to varying degrees. And we know that, as you'll be hearing from us, we talk about in the framework what we are doing, but we know that in each of these areas, there's room for improvement. And actually, in some of these areas, a lot of room for improvement about what we as a federal government and society can do. And that's truly why we're here. We're here because as the number of adults continues to increase, and really significantly increase, the number wanting to live at home and age in place continues to increase. So our job collectively is to make sure that we are able to serve their needs, to find new and better ways to coordinate our programs so we can facilitate states and communities as they drive coordinated, innovative solutions. More than 77 million adults over age 60 are truly counting on all of us to develop a national plan and to see this plan through to implementation. So that really brings us full circle to the path ahead and what today is in large part about, which is how we can partner with all of you to engage your networks and critically to partner with older adults, diverse older adults from all different communities with different issues and different concerns and different needs all across the country to inform the development of a national plan on aging. And as we move forward, we are really so appreciative to be working with the National Plan on Aging Community Engagement Collaborative, which is made up of a number of foundations who are just committed to and supporting this work. The John A. Hartford Foundation, West Health, and the SCAN Foundation. And they are a critical partner working alongside us to help engage older adults across the country, again, especially those with the greatest social and economic need. And in a few minutes, you'll hear more from Carrie about additional engagement opportunities that we have planned. Finally, as I'm ending my portion of today's remarks, I really want to thank each of the ICC member departments and agencies. And I just want to share a story. Many of us, are part of many interagency working groups, and sometimes you kind of have to twist agencies' arms to get them to show up. It has been the opposite here. In fact, we started and thought, let's just keep it to a small group with the key agencies. And we started getting email after email after email saying, actually, my agency would like to join. Can I bring more people from my staff and from my team? And I just want to give a huge shout out. This is not something that our federal partners did because they had to. This is something that they did because they are committed. They see where our programs are stronger when we work together. And so I want to call out not just my many colleagues across ACL, but we have had AmeriCorps and ARC and ASPE and CDC and CMS and HUD and Department of Labor and Department of Transportation and HRSA and National Institute on Aging and OASH and SSA and SAMHSA and USDA and the VA. I know that is such a alphabet soup of agencies, and I think if I wrote them all out, it would have taken a half an hour. But just, I promise you when I say that the commitment to older adults, to this framework and this strategy is deep across the federal government. And truly creating this framework would not have been possible without the dedication and input of so many of our federal colleagues. So our sincere hope is that you will be engaged with us in the framework and the development of this future national plan on aging. This is not just ACL's. This is not just the federal government's. This is our framework. This is our national plan on aging. And I am so excited to make sure that the work that we are doing not only helps people age and live the lives that they want, but we can truly change the narrative on aging and combat ageism. So I'm going to now turn things over to my colleague, Kelly Cronin. And Kelly, the floor is yours.
Thank you, Allison, and thank you all for taking time to hear today about the strategic framework. We're excited to be able to share the highlights of the framework with you today and to continue to engage with all those who want to be part of developing a national plan on aging. So last week we publicly released the strategic framework, but we also shared it with members of Congress as it's the first ICC report to Congress. And as you also heard, ICC is authorized under the Older Americans Act. As a part of that authorization, we will be continuing this work over time to coordinate across federal agencies and also advance recommendations to Congress. So this report is the first report in this first 2-year term of the ICC, but there will be national recommendations and progress to report in future 2-year terms of the ICC. So the work will continue. We anticipate that this will be an important mechanism for our ongoing federal coordination, state coordination, and coordination with our key stakeholders. And it also allows us some accountability for the important progress that we all need to make as a country to help our growing population of older adults live their best lives. And as Allison also mentioned, we're at a critical time when we have over 77 million older adults and a rapidly growing population, but they're redefining what it means to age in America. Many now are very active, technology savvy, working longer, living longer, but we also recognize there's many inequities and problems to overcome and solve. As we really want to change the aging experience for all. We're fully cognizant of these significant demographic changes that lie ahead, and we need to be deliberate about how we prepare our nation for a growing and more diverse aging population. The framework describes these key issues that we need to address to prepare our nation for the future. It's the initial step in the development of a national plan on aging to improve the experience of aging in America. So we're fortunate to be able to build on the significant progress across states, and many have already started or are implementing multi-sector plans on aging, or what we refer to as MPAs. And their in-depth and comprehensive efforts have laid the groundwork for coordinating across levels of government and with the private sector to advance a national plan on aging. The framework also highlights our existing federal coordinating efforts. For example, those related to caregiving, housing, transportation, and addressing health-related social needs, which we need to leverage in developing a national plan on aging. In addition, we've gleaned insights and strategies from the National Academy of Medicine's Global Roadmap for Healthy Longevity and the UN Decade of Healthy Aging Plan of Action. These global reports emphasize that lives of good health, function, meaning, purpose, and dignity are achievable. And now is the time to seize this opportunity and begin working towards a better future for all. So to ensure alignment with state MPAs, we analyzed how the framework, both the domains, the 4 domains that Allison covered, and the focus areas within each domain compare to the priorities across MPAs to date. So as you can see, there's really good alignment and agreement that we need to work together to address purpose, social connection, accessibility, transportation, financial security, employment, housing, caregiving, elder justice, access to services, and optimizing health and functioning. We know we need to work across all levels of government to make progress in these areas and intend to do so as we move forward. Aligned planning and implementation of these plans will help make this possible. So we're now going to walk through each of the 4 domains in the strategic framework. And just to recap briefly, it's age-friendly communities, coordinated housing and supportive services, increased access to LTSS, and aligned healthcare and supportive services. These domains and the focus areas within each domain harmonize with the priorities again in local, state, and global plans on aging. And this will guide our national plan development, our future recommendations to Congress, and benchmarking future progress. So our first domain is age-friendly communities. And for each of our domains, we have a goal statement, focus areas, and action statements. So for age-friendly communities, our goal is for all older adults to live in communities that respect and include them and are designed to encourage health, well-being, engagement, and connection. Our focus areas include purpose and engagement, social connection, accessibility and universal design, transportation, economic and financial security, employment, and age-friendly health systems. So for the rest of the presentation of the domains, we're going to go over each of the focus areas, and then for each focus area, we have an action statement, and then we highlight an example that we point out in the framework to show how we're already making progress related to that action statement and that focus area. So for purpose and engagement, our action statement is to coordinate across sectors to cultivate opportunities for older adults to participate in their communities in meaningful ways that aligns with their individual goals. And one thing that we highlight in the framework is the foster grandparent program, which connects older adults to young people to support healthy futures through mentorship and tutoring. So we have 5 additional focus areas in age-friendly communities. The next one is social connection, where our action statement is to facilitate opportunities for the development and maintenance of quality social networks and relationships for all older adults. As many of you probably know, our Surgeon General has been a champion for social connection and has released an advisory that has laid out a strategy for our country to advance social connection. But we also have opportunities through the implementation of the bipartisan infrastructure law that advances provisions that support accessible public transportation and expands broadband access. So our third focus area in age-friendly communities is accessibility and universal design. This involves prioritizing activity-friendly and inclusive environments that support older adults in participating in everyday activities through community-engaged design and implementation. And one recent success that we want to highlight is the new rulemaking that updates Section 504 of the Rehab Act which strengthens anti-discrimination protections and ensures equal opportunity for people with disabilities, including older adults with disabilities. Our fourth area is transportation. We focus on collaborating to improve transportation availability and affordability to support older adults in safely accessing everyday destinations and in maintaining their independence. There's many things we highlight in this section as well. One of them is around the innovative coordinated access and mobility pilot program that funds projects that improve coordination of transportation services and non-emergency medical transportation services. Our fifth focus area is economic and financial security. Our action statement is promoting economic stability for all older adults by building financial knowledge and streamlining access to benefits and services. And again, there's a lot already happening across federal agencies and government related to this. But one of our highlights that's a really significant one is the implementation of the Inflation Reduction Act that supports economic security of older adults by expanding the low income subsidy program under Medicare Part B. This allows reduced drug plan premiums and plan deductibles go to zero. So it's reducing the overall cost sharing for prescriptions. Our next focus area is employment. And our action statement is to expand employment opportunities that recognize the expertise of all older workers by promoting work environments that are safe, flexible, accessible, and promote intergenerational exchange. And a highlight here is the EEOC Strategic Enforcement Plan that highlights age discrimination as a priority area for enforcement. And the last focus area for age-friendly communities is age-friendly health systems. Here we're focusing on ensuring providers coordinate across sectors to support whole healthcare needs of older adults with a focus on individual strengths, needs, and outcomes. There's been significant progress to report and to share on age-friendly health systems, and we highlight the great work in the Department of Veteran Affairs and their age-friendly health systems initiative, which has been supported through the John A. Hartford Foundation and the Institute for Healthcare Improvement. Generally, we are trying to promote communities that are responsive to the needs, values, and preferences of older adults. It requires an understanding of aging as a process shaped by individuals interacting with their environment. People of all ages benefit when they live in places that are designed to encourage health, well-being, engagement, and connection. So with that, I'm going to transition to Emily Rosenoff.
Thanks, Kelly. Nearly all older adults want to remain in their homes as they age. Accessible and affordable housing is essential for people to thrive in their communities. To support healthy aging, we must offer a range of housing options across the lifespan, regardless of income and functional ability. Stable housing often requires a continuum of services to support older adults so that they can live safely in the community. Access to home and community-based services can help individuals meet their needs and potentially avoid unnecessary hospitalizations and live in the community longer. The ICC's goal in this domain is that all older adults have access to housing and the services they need to maintain their independence at home and thrive in their community. Key focus areas under this domain include affordable and accessible housing, preventing and addressing homelessness, and housing stability through coordinated services. Next slide, please. Affordable housing is a major issue across the lifespan, but for older adults, it's a particularly important issue. The number of older households with moderate and severe cost burdens has been increasing for more than 2 decades, with nearly 11.2 million older adults paying 30% or more of their income on housing. If individuals are spending a disproportionate amount of their income on housing, they will be unable to afford other essential budget items, such as food, utilities, and medications. Multiple systematic barriers limit development of new affordable housing. To address these challenges, the ICC established the following action statement: increase the supply of accessible, affordable rental and home ownership opportunities for older adults by expanding and streamlining federal, state, and local funding, policy, and cross-sector partnerships. The federal government is investing in several initiatives to further progress on affordable housing with direct benefit to older adults. For example, HUD's Pathways to Removing Obstacles to Housing, or PRO housing program, provides funding to communities for planning and policy activities related to zoning, mixed-use housing, and reduction of land use restrictions. Not only do we need affordable housing, but we also need the housing to be high quality and accessible for individuals with functional limitations. Climate resilience will become increasingly important. This means enabling households to adequately maintain their homes against climate challenges. In addition, most housing stock in America is not accessible, nor are most housing units easily modifiable. Only 10% of American homes are, quote, age ready. Almost 20% of US households include someone with an accessibility need, yet 40% of those households with an accessibility need are in homes that are not fully accessible. Older adults and their caregivers bear most of the financial responsibility for home modifications. The ICC notes the importance of improving opportunities for older adults to access and maintain accessible quality housing that is healthy, safe, and climate resilient. Current federal efforts underway in this area include the Department of Energy's Weatherization Assistance Program, HUD's Healthy Homes Program, the Department of Agriculture's housing programs, and ACL's Falls Prevention Program. On homelessness, older adults are the fastest growing age group of those experiencing homelessness, comprising nearly half of the homeless population. The number of older adults experiencing homelessness is forecast to triple between 2017 and 2030. In addition to the aging of a population of individuals who have experienced homelessness at earlier points in their lives, we are hearing of growing numbers of individuals experiencing homelessness for the first time after age 50. These individuals may have had a later in life job loss, a medical crisis, divorce, or other disruption. Housing loss has many complex triggers, and addressing the crisis requires coordination across all levels of government, sectors, and programs. ICC action statement for this area strongly emphasizes the prevention of homelessness among older adults by fostering intentional coordination across national, state, and community levels. One example of this already in place is the U.S. Interagency Council on Homelessness. The USICH is made up of 19 federal agencies and coordinates the federal response to homelessness. In 2022, USICH released a strategic plan, All In, which lays out a comprehensive plan to prevent and end homelessness using a coordinated approach across federal, state, and local partners. Next slide, please. Our last focus area on this topic is coordinated housing and services. Many providers of affordable and accessible housing work with community-based organizations to help older adults with complex needs to coordinate the services that they need. Such coordination could focus on bringing in services to buildings with large number of older adults, or services to support individuals with a history of homelessness or housing instability. Our action statement for this focus area reinforces collaboration at the federal, state, and local level to improve access to housing assistance and related services to help older adults remain stably housed and thrive in their communities. The ICC report provides several activities that are underway now in this space. One major initiative is the HHS HUD Housing and Services Resource Center. This cross-departmental effort is coordinating federal and state programs to support housing and services to meet individuals' needs. As part of that resource center, the Housing and Services Partnership Accelerator is providing tailored TA to 8 states and DC to develop or expand innovative housing-related supports and services for individuals with disabilities or older adults who are transitioning from institutions or who are at risk of or experiencing homelessness. In addition, the Centers for Medicare and Medicaid Services, or CMS, has been providing guidance to states on how they can better support their Medicaid beneficiaries' healthcare needs. Individuals with unmet health-related social needs may have challenging accessing the necessary healthcare services that they need to thrive. CMS in 2023 released a document outlining the ways that states can use Medicaid Section 1115 research and demonstration waivers to cover health-related social needs, including housing-related supports and services. And with that, I'm pleased to turn things over to Vicki, who will cover the increased access to LTSS domain.
Thank you, Emily, and thank you to everyone who has joined the call today. Increased access to long-term services and supports allows older people to continue participating and enjoy full lives and experiences in the settings that they choose to live. Our goal statement in this area is that all older adults can easily access affordable, high quality, and I want to emphasize high quality services and supports that promote both their independence and their goals. We have 4 focus areas in this domain: paid and unpaid caregiving, whole person health financing, elder justice, and person-centered access system, no wrong door, and other statewide access systems. Next slide. So our first focus area is paid and unpaid caregiving. As Allison said, the issue of caregiving is an issue of primary importance to this administration, and probably primary importance to people who work with older people and people with disabilities. I suspect that many people who are participating in this call have served as or are currently serving as caregivers. Our action statement is to build on existing momentum to support a well-trained, well-paid, long-term services and support workforce, enhance collaboration between paid and unpaid caregivers with the goal of promoting the needs of caregivers, those receiving care, and their families, regardless of where they're accessing support. In our example is ACL's Direct Care Workforce Strategies Center, which provides technical assistance to 20 states, as well as service providers, and facilitates collaboration with stakeholders to improve the recruitment, retention, training, and professional development of members of the direct care workforce. The Strategies Center include many of the agencies and departments that work on the ICC. When we talked about increased access to long-term services and supports, the issue of the paid and unpaid workforce was probably the issue that everybody agreed on that we wanted to identify. The next issue that we call upon is whole person health financing. It's okay to have long-term services and supports, but how do people access them? How do people pay for them? How do states, how do the federal government pay for these services? How are they coordinated? Our action statement is to build upon existing efforts to promote coordination across health systems, improved access to Medicaid LTSS for people who are eligible, as well as state-based innovations that facilitate financing and programs. We know that there are people who are not eligible for Medicaid. We know that the Older Americans Act provides some long-term services and supports. We know that Medicare provides limited long-term services and supports through its limited home health benefits. There are VA provisions, and people need to know how to access these provisions and to keep getting those access to those provisions as their circumstances need. CMS recently issued new regulations to strengthen Medicaid-funded HCBS. The ensuring access to Medicaid services rule includes numerous provisions to improve Medicaid HCBS and to make things easier for people. One of the provisions that really goes unnoticed, but is important here, is the provision that creates a grievance process for people who believe they were denied services inappropriately. By having a grievance process, people will be able to ensure that they can talk to and appeal denials of care when they're eligible, so that they continue to receive the long-term services and supports that they need. Our next focused area is elder justice. Elder justice really is one of those cross-cutting issues that apply in every domain. In fact, the Older Americans Act recognizes the importance of elder justice through its own provisions and through the requirement that area agencies on aging fund full-time legal services to assist people with legal needs. Our action statement here is promote the rights of older adults, including those who need LTS, and prevent adult maltreatment. We know that, for example, access to long-term services and supports is both a tool for prevention of adult maltreatment. It's also a service that can be provided to assist people who are being abused and neglected. I'm really excited to give our example of the Elder Justice Coordinating Council as a federal activity with regard to elder justice. The HACC coordinates activities related to elder abuse, neglect, and exploitation to better serve victims of maltreatment and hold perpetrators accountable. What's fun is that the HACC is celebrating its 10th anniversary this week. So it's really important to highlight the work that they do. The HACC is made up of 17 member agencies, departments across the government who work together, and many of them are partners in the ICC. Next slide. Our final focus area is person-centered access systems, No Wrong Door, and other statewide access systems. Our action statement is really to build upon and advance outreach so people know these systems exist, information and referral, assistance, and person-centered planning through federal and state collaboration, including optimal IT infrastructure, workforce development, public awareness, to expand upon existing efforts to promote approaches to LTSS that take into consideration the goals, preferences, and needs of the person. The example that we provide is the SAMHSA's 988 Suicide and Crisis Lifeline, which offers 24/7 call, text, and chat access to trained crisis counselors. People can call, text, or chat if they are worried about a loved one or they themselves need crisis support. Finally, I want to call out the quote at the bottom. We at ACL, with our partners, held a listening session at the Deanwood Community Center in Washington, D.C. last month, where we brought together almost 80 older people to listen to them and their thoughts on the needs on the domain areas. And one of the people who participated said, family members are the key support. It takes too long to get the paperwork in order to get people the services that they need. We're hoping through the strategic framework, we can support family members and we can address the burdens of getting access to LTSS. Carrie, I'm turning it over to you.
Thank you, Vicki. As we age, we will likely need a range of healthcare and social supports. However, older adults often face fragmented health and supportive services delivery systems. While the U.S. spends more on healthcare than any other developed country, older adults do not always experience positive health outcomes from this level of investment. Also, there is growing recognition of the relationship between non-healthcare factors such as physical activity, nutrition, and lived environment, and a person's actual and self-reported health, facets that Older Americans Act has been addressing for decades. So in our fourth and final domain, aligned healthcare and supportive services, our goal statement from the ICC is that all older adults maximize their health and reduce preventable disease and injury through comprehensive care that includes health and social services in the home or in the community. And within this domain, we have three focus areas: benefits access, optimize health, well-being, and functioning, and align health and human services. So if we go to the next slide, let's jump into benefits access. Access to healthcare and supportive services is vital to ensure we can all age well in our communities. Social services and financial assistance programs through federal, state, and local pathways can provide crucial support to cover medical expenses, receive long-term services and supports, access transportation, and connect with other essential services. All older adults, regardless of geographic location, language spoken, or lived experience, should be able to have timely and simplified access to these benefits. When this happens, their health, well-being, and independence improves, promoting quality of life while reducing the need for costly and at times inappropriate and unwanted institutional care. Our action statement is to increase timely access to benefits by enhancing affordability, availability, and awareness through increased coordination across governmental agencies and community-based organizations. Our example is the Centers for Medicare and Medicaid Services efforts to streamline access to the Medicare Savings Program that will increase the number of older adults enrolled in the program, which helps to reduce beneficiary cost. Moving on to the optimize health, well-being, and functioning focus area, we focused on programs that promote the physical, behavioral, social, and functional health and well-being of older adults, and that these have shown to improve overall quality of life and reduce the health and economic costs on healthcare systems and caregivers. To maximize the impact of disease prevention and health promotion interventions among older adults, programs must be accessible, affordable, and person-centered. Our action statement for this focus area is to promote and increase utilization of services, programs, and supports to maximize the physical and behavioral health of older adults. ACL has been proud to partner with the Centers for Disease Control and Prevention on several national and community-oriented programs, such as efforts to reduce falls and fall-related injuries, promote vaccine access and increase vaccinations among older adults and people with disabilities, and empower those with and at risk for chronic disease, particularly individuals with diabetes. So if we go to the next slide, our third focus area in this domain, third and final, is to align health and human services. Health-related social needs are an individual's unmet needs and experience of adverse social and financial conditions that contribute to poor health outcomes. Examples include poor nutrition, financial insecurity, housing instability, pollution, limited English proficiency, and lack of transportation. These needs can exacerbate health conditions and negatively impact access to care. There's growing recognition by the healthcare systems that the role that health-related social needs play. However, addressing these needs is often beyond the ability of healthcare systems and requires their awareness of and collaboration with community-based human services organizations. Our action statement for this focus area is to improve the coordination of services that address health-related social needs through multi-sector partnerships inclusive of healthcare, community organizations, and individuals with lived experience. Several federal efforts are underway to do just that. The White House's U.S. Playbook to address social determinants of health and the HHS Call to Action addressing health-related social needs in communities across the nation identify models that are designed to manage partnerships across sectors to improve the health and well-being of individuals and communities. And now let's switch gears here and go to the next slide. And we've spoken a lot about the content of the framework. And now we're really excited to talk about our next steps together. As Allison mentioned, we are really looking to, starting today, launch a national movement with you that inspires tangible actions and makes a difference. The promise embedded in the strategic framework extends beyond government coordination. Its vision, values, goals, and actions are intended to create and strengthen cross-sector partnerships to address ageism and create a pro-aging future for all of us. And we want to hear from individuals, communities, and service advocacy leaders in partnership with the National Plan on Aging Community Engagement Collaborative. We want to create dialogue at the community, state, and federal levels on leveraging our collective strengths toward our vision, and we want to create recommendations in alignment with each domain. Next slide. As you heard from Allison, and then Vicki mentioned this as well, our work together has been with the federal agency partners in particular in crafting this strategic framework, but we've also had the pleasure of working in partnership with the National Plan on Aging Community Engagement Collaborative.
And Carrie, if we could ask
yes.
you to just pause 1 second. I think we are having an issue with our ASL interpreter who got kicked out of the webinar. And Marcia, let us know when we are back on. We want this to be accessible to everyone, and this is especially an important point to make sure is accessible. Okay, so Marcia, just let us know. Thank you, Carrie, for taking a quick break.
We're all set.
Okay, great. So back to you, Carrie, and you can unpin me. Thanks.
Thank you, Mercy, and thank you, Allison. I get so excited about this. I'm not paying attention to anything else going on. I'm excited to tell you about the work that we're doing to begin to engage individuals such as all of you and your networks beyond the federal agencies that have been involved so far. As part of our work, we've partnered with the National Plan on Aging Community Engagement Collaborative. This includes West Health, the John A. Hartford Foundation, and the SCAN Foundation. Working with these partners, we held the first listening session, as Vicki mentioned, at the Deanwood Community Center. We are looking to have more listening sessions. The Community Engagement Collaborative in particular will be supporting those. They will also be supporting a national representative poll of older adults. We will be hosting a variety of listening sessions at different conferences, and there will be other opportunities to be planned and announced coming forward. And this is all in an effort to get as much feedback as we can regarding the strategic framework and then feeding into ultimately our National Plan on Aging. Next slide. So we want you all to engage with our work. First, we want you to read the framework. You will see the link here. You can click on the link and read the full framework and dive into those domains most relevant to you. We want you to pick part of the framework, identify something that you want to talk about with somebody else. And we want you to, in that way, be a part of the pro-aging dialogue. You can also follow our future progress by clicking on this same link. So you can sign up, of course, for our ACL updates that we send out. You can also sign up for updates, particularly regarding our work to develop the National Plan on Aging. Next slide. Again, be part of the pro-aging dialogue. The strategic framework seeks to break the patterns of ageism and ableism that serve as preventable barriers to older adults thriving in their communities. And really, this is about all of us thriving in our communities as we age. And you can all be a part of, with us, part of the pro-aging dialogue. So we want you to consider how you or your organization can help to break down patterns of ageism and ableism. You can click on the link to the right of your screen here, and we'll be putting that in the chat to go to the Reframing Aging Center, pick one strategy, one technique, and try it out and be a part of this national movement. Also, participate in the Aging in the United States input process hosted by the National Plan on Aging Community Engagement Collaborative. That is hosted by West Health, and we will also be putting that link in the chat as well. Next slide. And we want to thank you. Thank you for taking time today to learn about the strategic framework for the National Plan on Aging. And thank you in advance for being a part of our collective effort to develop our nation's first pro-aging plan. We really hope that you dive into this with us, that you help to get the word out about the input opportunities, and that you provide input yourselves. Again, we will stay in touch and want to thank you all for your partnership and going forward our work together. Thank you.